Missouri lawmakers are pushing new legislation aimed at reforming pharmacy benefit managers, companies that help control prescription drug pricing. KOIM's Blake Gully breaks down the proposal and why it matters.
Missouri lawmakers are filing legislation for the 2026 session that would completely change how pharmacy benefit managers, known as PBMs, operate in the state. PBMs negotiate drug prices and reimburse pharmacies, but critics say their practices often drive up costs while limiting access to care. One of the bill's co-sponsors, Senator Joe Carter, says these bills deliver long overdue transparency and basic accountability in the prescription drug system so families, pharmacists, and employers stop paying for more than they should while patients get the care they need. Supporters say the proposed reforms will require pharmacy benefit managers to provide full pharmacy claims data to employers and the state's Department of Insurance, allowing for greater oversight of prescription drug pricing. The bills would also prohibit PBMs from charging patients a copay higher than the actual cost of the medication. According to the Federal Trade Commission, in 2023, the top three PBMs processed nearly 80% of the approximately 6.6 billion prescriptions dispensed by the U.S. that year. Lawmakers backing the bill says PBMs often steer patients toward pharmacies owned by the same companies, a practice they argue puts independent pharmacies at a disadvantage and limits patient choice.
I've got people that I've been taking care of for 20 years or more that are suddenly getting letters that say they have to either use the mail order or they have to use the CVS retail store in another town. We don't even have one in our town. Sometimes people will have to drive 20 miles or more to get a prescription filled.
The bill will be considered during the 2026 legislative session. Blake Gully, KOAM News.
This month, Oklahoma announced a $5 million settlement with CVS Caremark, one of the larger PBMs, for allegedly underpaying pharmacies on prescriptions. According to the state, the win will help ensure reimbursement and reforms to protect local pharmacies and patients.